Hey guys, welcome to Striking Studies. So today we will be doing the chapter Why Do We Fall Ill? So the basic question, what is health? So the World Health Organization, WHO, gave the following definition of health. So health is the state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. And it also has the ability to lead a socially and economically productive life. So there are three types of health: personal health, community health, and social health. So personal health is your own health. Community health is everyone in your community's health. Social health is having a good job, a good house, happy friends, good neighbors, and understanding friends. Now, what are the basic conditions for a good health? There are 7 basic conditions for a good health: a balanced diet, proper healthcare services, proper facilities for preventing diseases, proper hygienic and sanitary conditions of the environment, imparting health education and promoting public, clean water and air, providing socio-economic conditions, which is basically the social and economic balanceable conditions for social health basically. So now, before we actually get into this chapter, there are some keywords which we need to know. So the word disease means disturbed ease or discomfort. So disease can be defined as the malfunctioning of a body or a part of it due to one reason or another. So a disease is basically a harmful change that interferes with the normal appearance, structure or function of the body or any of its parts. So this really ancient person called Hippocrates was the first to look for a scientific explanation for diseases. Today he is remembered as father of medicine. So, and then there's the pathogen, which is a disease-causing organism. Now, a few more key terms. So, there are two things which help in the diagnosis of a disease, which is a symptom and a sign. So a symptom is a change in the normal functioning of the body and it is felt by the patient, but the doctor cannot feel it. Like they only tell some rough idea like headache, stomachache or something. So headache there can be a bunch of causes for headache. So a doctor won't exactly know what the cause is. And then there's the sign. A sign is a change in the body function or structure that can be observed. You can't observe a headache, but you can observe rashes, swelling of a gland, change in color of skin, etc. These give doctors good ideas of what a disease is. So now, what are the diseases and its causes? There are two causes: immediate cause and contributory cause. So the immediate cause is the microorganism which causes the disease, a pathogen basically. And the contributory cause can be lack of nourishment, economic status of household, genetic factors, poverty, etc. Diseases causes can also be classified as first, second, and third level causes. So first is like the important primary cause, which is the pathogen. Second level cause is lack of good nourishment, and third level cause is poverty and lack of public services. So now, the factors which affect human health are of two major types: intrinsic or internal factors and extrinsic or external factors. The factors inside our body which we are inborn with are intrinsic or internal factors. And the factors that come from outside our body like germs are extrinsic or external factors. So now, intrinsic or internal factors. These include malfunctioning of various body parts such as heart, kidney, liver, etc., genetic disorder, hormonal imbalance, malfunctioning of immune system. So the diseases caused by intrinsic sources are called organic or metabolic diseases, and these diseases include heart attack, dwarfism or giantism, kidney failure, and cancer. Now, by extrinsic or external factors, include unbalanced diet or inadequate diet, disease-causing microorganisms such as virus, bacteria, fungi, protozoans, helminths, etc., environmental pollutants, tobacco, alcohol, and narcotic drugs. So I made this very nice mind map after a lot of difficulty. This is basically the classification of a disease based on certain factors like their duration, how did they come, and extent. So let's see. Based on how did they come, there are two types of diseases, congenital and acquired. So congenital diseases are either caused due to genetic disorders or they are inborn. They are also called inborn diseases because, like I said, they are inborn. They occur since birth. Like these diseases can be also inherited and can also cause a metabolic disorder or malfunctioning of any organ or organ system. Example, hemophilia, sickle cell anemia, diabetes, etc. We can also include holes in the heart, I guess, because some people are born with a small hole in their heart and they need surgery to get it right. Okay, so acquired diseases are acquired by the organism after birth and it's not inheritable. These are of two types again, communicable and non-communicable. Now, communicable disease. These are diseases which can move from a healthy person to from an affected person to a healthy person. So example, coronavirus, which is happening right now. So it can be transmitted from air, water, food, physical contact, and insects. Now, non-communicable disease. The diseases which do not spread from person to person. So these don't spread like diabetes. Like if you go near a diabetic patient, you don't get diabetes. And cancer. Their causes vary, but they do not have an external cause like microbes that can spread in their community. Their causes are mostly internal, so they are non-infectious. So the types of non-communicable diseases are four types. Degenerative disease, which is some disease which you get after you get old because of the degeneration in structure and function of the body, cells and organs. Example, cataract, where you cannot see properly, arthritis, which is a knee pain, and cardiovascular diseases like the heart related ones. Now, deficiency disease. So these are caused by the deficiency of any nutritive element of the food. These just the deficiency of that element leads to poor functioning of that body part. Example, night blindness is caused by deficiency of vitamin A, where you don't see properly in the night. Scurvy, which is the bleeding of the gums and the teeth, is caused by deficiency in vitamin C. And anemia is caused by deficiency of vitamin B12. Now, allergies. I'm pretty sure a lot of you know what this is. It's basically the hypersensitivity of a body to some specific substance in the environment, like hay fever, asthma, skin and eye inflammation, skin rashes, etc. So the substance that causes the allergy is called allergen. So if you're allergic to pollen grains, the pollen grain will be called an allergen. Now, cancer is basically the abnormal multiplication of cells in certain body tissues. Cancer is usually fatal. I'm sorry if that doesn't show in the slide. And the most common type of cancer is skin cancer. Now, based on duration, there are two types of diseases, acute diseases and chronic disease. So, acute disease is basically a short duration. It does not damage any organ. We completely recover after treatment and there is no actual effect, like long-term effect. And the only loss is interruption of work and efficiency for a short duration of time. Examples are diarrhea, typhoid, etc. A chronic disease, on the other hand, is long duration. It damages the affected organ due to the prolonged duration and it won't exactly be completely cured even after treatment, and it causes weight loss and feeling of weakness or tiredness. And the loss is interruption of work and efficiency for a long period of time. Example, tuberculosis, diabetes, etc. Now, On the basis of the extent of occurrence, a disease can be of four types. Epidemic, which is a disease which breaks out and spreads from place to place, affecting a large number of people, but it's not exactly the whole world, but it is quite a large number. For example, the plague in India in 1994 from Surat to many places. Now, Surat is one of the cleanest places on earth because of that. In India, actually. I don't know exactly which one. Comment down below, India or Earth. So, pandemic is a disease which spreads throughout the world. Example, AIDS, coronavirus, etc. Now, an endemic is a disease which is found in a certain area affecting a fewer number of people, like yellow fever in certain African countries, goiter in sub-Himalayan regions of India, etc. And the sporadic is one which just has scattered cases of individuals, like malaria, cholera, etc. It's not exactly like almost everyone in that place gets it, but it's just scattered, but it exists. So that's all for part 1. I'm pretty sure you're already bored. But comment down below how this video was, smash that like button, and don't forget to subscribe and press the notification bell to know when our next videos are coming. Bye guys!